HIV continues to remain a major public health challenge in India, and Karnataka is witnessing a worrying rise in infections, particularly among young adults. Health officials say one of the groups showing increased vulnerability is a group of homosexual men, college students, and sex workers, as well as mobile working population like truck drivers. Karnataka has the third highest number of people living with HIV in the country, with more than 2.6 lakh people estimated to be carrying the virus. The concern is that nearly 56,000 people may still be unaware of their HIV status, increasing the risk of further transmission. Among those aged 18 to 35, HIV registrations have seen a sharp jump, rising from 44,581 in 2023 to 24 to 66,606 in 2025-26. With Bengaluru reporting the highest share of cases, Karnataka government is now expanding awareness drives, testing facilities and counselling programs across colleges, hostels and universities. I'm being joined by Dr. P.S. Venkatesh Rao, who's an endocrinologist. Thank you very much, Doctor, for joining us at this point. Doctor, what do you make out of this data that we're looking at really? You know, when we talk about two instances that really, two group of people that really stand out. One is the young adult population from 18 to 35. And then you have also the whole category of homosexual men.
Good evening. I'm an endocrine surgeon, not an endocrinologist. And thanks for having me on the show. I have a vague feeling that the incidence is much higher in other parts of India. It's just that the data is not available. There's a far more amount of scrutiny and checking and data collection going on here. And of course, Bangalore has become a center for a lot of mobile youth, both those who are studying and those who are working, as you have mentioned. Now, the main problem here is that we need to educate the youth as to the importance of avoiding unsafe sex. This is the only way the AIDS really spreads, other than through blood and through the other population, which has not been mentioned in all the statistics, is the drug addicts. Because if they share needles, there is a high risk of AIDS spreading that way. As far as the blood transfusions are concerned, most places in India are thoroughly checking blood before it is transfused for not only HIV, for various other forms of infections like hepatitis B, C, and all that. So we have to get the message across to all this youth in a way that they don't think that they are being isolated, they are being, humiliated, etc. And hence that law which says that without consent you can't check for HIV. We have to encourage people to, those who are at risk. But first of all, we have to make them realize they are at risk. The problem is people are not even aware. They are just freely going around. And then later on, when they land up in trouble, and HIV doesn't show up immediately. The problem is
that's one thing it's important to understand, and specifically because we are looking at the group of 18 to 35. I mean, let's just look at this. Why is this 18 to 35 group so vulnerable, according to you? What makes this category so vulnerable?
And because this is the group which is not only the most sexually active, they are the most exploring various, even unknown, because there are now various apps which give you anonymous sex, etc. So they don't even know whom they are having sex with. They are just being very explorative. This is a problem with the youth. The youth is very explorative. They're very curious. They just want to try out all sorts of things. They need to be warned that this doesn't work. if you see drunken driving also and various other such things, you will find that it is more among this youth, especially sexually transmitted diseases, because they are very explorative. They are trying all sorts of things, and social media is also encouraging all kinds of sexual explorations and other explorations. So we need to get the message across to these people that if you have the following behavioral characteristics, you may be at risk. Actually, there is an app which puts 7 questions, and if you find that you are saying yes to those questions, then you are likely to be at risk, encouraging you to come and get yourself checked, so that if you are infected, if you start early with treatment and not wait for the symptoms to come, which may come months or even years later, at least you will save yourself, and you will also prevent spreading the infection to others. It is important for people to realize they are infected very early, and those who are not infected to remain safe by using condoms and avoiding sexual intercourse with the people whom they don't even know if they are AIDS positive or not.
Right.
It's a
Right.
containment policy.
Right, sir. Talking about just the HIV infection, for that matter, being HIV positive, from being infected to finally developing symptoms, how long is this duration? Because unlike other infections, the gestation period or the period before you really manifest your symptoms, there's a considerable gap when it comes to HIV cases, isn't it?
Yes, see, the problem with HIV is it is basically destroying your immunity. That means it is destroying your defense system. Now, that leads to various unusual infections, fungal infections, and bacterial infections. And some of these infections are not seen in otherwise healthy people. And so they may not realize that this infection is because their defense systems are down. And this takes quite some time before the defense system is down. And most of our tests, see, when you do an annual health checkup, one, you are not checking the immune system. This is something I even keep discussing with doctors. There are two systems of the body which are not too well understood even by doctors. Forget about all these young youth in heat. This is the immune system and the endocrine system. The endocrine system is poorly understood because it is like a remote control. Unlike a neurology, a neurosystem. A neurosystem is like an electric. If you put the switch, that specific bulb comes on. But in hormones, it is like a remote which puts on all the bulbs or all the washing machines or all the whatever it is meant for. But immune system, the problem is the defenses are down. And it is only when either Pakistan or China or someone else invades you, then you realize that there is something wrong. But you don't know why, what is wrong. This is the problem. I'm just trying to put it in simple language that people understand. It is that your army is missing, it has been destroyed, and you suddenly find all your aggressive neighbors are just walking in. And then you wonder what the hell is going on. And here it is not even the common infections, these are uncommon infections. This is like unexpected people walking into your nation because your defenses are down. This is the issue. And it will always be maximum in the youth. And this is why in Africa, when the AIDS epidemic started, many nations in Africa were left without that age group missing.
No, you talk about youth, and obviously we spoke about how 18 to 35 is the most vulnerable group.
Yes.
But also another group that's emerging when we look at the Karnataka profile of cases is the homosexual men.
Yes. Because it is, see, the homosexuals are far more likely to have unsafe sex. That is the whole problem. And to have multiple partners. When you have multiple partners and you have unsafe sex, there are far more incidents of sexually transmitted diseases spreading. And then if you, in addition, the sex workers are involved, that adds to the whole problem. Now, how many sex workers get themselves tested? Are they aware of it? And how many of them are professional sex workers and how many are casual sex workers? How many are, you see, there are many apps which are encouraging casual sex with unknown people. This is a dangerous state of affairs. And we need to get the youth educated. And most schools and colleges don't like to hold sex education at all. There is no proper scientific sex education to the youth. This is a huge problem. And like Africa, if we wait till an epidemic is there, we are going to be in serious trouble.
Right, right. Thank you very much, Doctor. Thank you so much for
Thank you.
joining us. A very important conversation, and I think there's much to learn from what's happening in Karnataka as well. As you said, I think surveillance and vigilance in other states is also of very
Yes.
crucial significance for that matter. Thank you very much, Doctor, for joining us.